Well, it's 5:32, so I'll go ahead and we'll get started. Good evening, everyone. My name is Julie Williams Hill. I'm the Public Information Officer for Los Alamos County. I want to thank you for taking the time to join us for tonight's virtual town hall to discuss helicopter operations in our community. From the county, we have our airport manager, Gary Goddard. From our fire department, we have Emergency Medical Services Division Chief Manuel Pacheco and our Emergency Medical Services Captain, Kevin Camplain. We also have Eric Martinez, our Public Works Director, and Juan Real, who is our Deputy County Manager. At this point, I'm going to go ahead and turn it over to Gary, who's going to introduce our guests from two of the three helicopter organizations that provide services in our area. So go ahead, Gary, and I'll go ahead and stop sharing this screen.
Hi, everyone. Nice to be here. So I've been the airport manager for about 6 months now. So I'm still learning things and learning what everybody's roles are and I've seen a lot of operations by particularly Classic Air, but from all three of the medical service providers here. And since the time that I've been here, our automated tracking system tells us that about a third of the operations at the airport are from the medical services. And that's the majority of those by far are Classic Air Medical or Intermountain Health. They were recently acquired, so I don't exactly know which name to use every time, but we'll say Classic Air because it rolls off the tongue a little easier. If you don't mind, Bob. And so anyway, so about a third of the operations are from the medical services. And at least over the last few months, that's been about 90 flights a month for the medical services. And I've told the other medical services, the other companies that are represented here are fly about 1 or 2 flights per month. So the majority is through Intermountain Health, Classic Air. So, I just wanted to maybe introduce Bob Cook from Classic Air, and Bob can tell us, Bob, can you tell us just basically what your company does and the services that they provided, and maybe a little bit about the operations to and from, and maybe some of the exceptions that you guys get on the restricted airspace?
Yeah, so we provide emergency services, air ambulance services. We also provide search and rescue service. So what we do is we respond to whatever it is we're called to, and that could be an interfacility transport out of a hospital, or that could be a scene call, so a 911 call through any of the dispatch centers that are nearby, and we would respond directly to the scene, or a rendezvous point, like a landing zone that's coordinated with the EMS service that's asking for us. And then we would transport those patients to the most appropriate facility based on their injuries or illnesses. And then we also do the search and rescue aspect, where we provide our search and rescue folks 2 hours of essentially non-charged search and rescue assistance to help them find people that are lost or missing or whatever may have you. So that is what we do in a nutshell. And I'm sorry I forgot the rest of your question, so if you'll remind me.
Well, I guess maybe you could just briefly talk about the operations to and from the airport to the hospital and how that kind of works. I think my understanding is that people do stay at the airport. Some of the crew does, and maybe you could just explain a little bit of the logistics about that.
Yeah, so currently nobody stays at the airport. We do have the hangar there, so that way when weather gets bad or when we need maintenance done or whatever, we can reposition helicopters over to the airport and we can work on them, or stash them inside so they don't get damaged in hail or high winds or whatever the weather conditions may be. Excuse me. I believe you had asked about the exceptions maybe we get through the restricted airspace. So some of you may be familiar, but the National Laboratory has restricted airspace that comes pretty much right over the canyon that would border to the south of Smiths there. And they do provide us an exception to clear through that restricted space. So that way, that's one of the things we do to try to keep the noise down for the folks in town, is we use that fly route the most frequently. As long as it's open, we do have to clear that through Lanel every single time we go through it. And sometimes it's closed and we can't go through there, but the vast majority of the time, I would say like 99% of the time, it is open and we are able to fly that route in and out to the helipad at the hospital. So that way we can avoid flying over the most populated areas.
Right, Bob, I think I misspoke. I said airport and I meant hospital. I think you do have that end up staying up at the hospital. And so they're ready for deployment.
Yeah, we don't currently have any housing in the hospital itself. We have some housing close by. We actually have 3 places that we lease in town. 2 of them are for pilots and for maintenance staff, and then 1 of them is for the med crew. And so they're not too terribly far away, and so we're able to respond as quick as possible to get to that helipad.
All right, that sounds good. Okay, well, thanks, Bob. Let's move on to John Martinez, JP as I know him. And JP, can you do similar? Just explain, maybe how many operations you guys do up here and how it works with you guys.
Yeah, so very similar to what Bob mentioned. We operate a Part 135 certificate. We do inter-facility and 911 responses, taking patients anywhere from northern New Mexico, probably a 90-mile radius, and to facilities in either Santa Fe, Albuquerque, and sometimes north. So that's the gist of our operations as specific to Los Alamos. We probably go there once to about 3 times a month, depending on the need there. And just like Classic Air does, we would primarily utilize LAMC helipad for those pickups. We can respond to sync calls within the county. Currently working on getting some connections with Lanel. Work for a different company where we say do exactly what Classic does, and get approvals for that restricted area just so that we can have better approach paths. So I'm in the works of doing that and getting that approved through our corporate department, making sure that we have policies in place for utilizing that and having that part of our normal operations when landing at LAMC. We use the airport at times, very seldom. There's been a few times we had to relocate to wait to get a helicopter repositioned from the helipad, but for the most part, we're using the helipad for those operations. We do part of the Part 135 certificate does allow us for search and assist. That just requires a phone call from our pilot, and we do searches, and we do a few number of those throughout the year. We do not do rescue. We do not do a hoist or any type of operation like that. It's strictly search and assist. But we can land without somebody on the scene, as long as we have a first responder status or ground communications in that area.
Yeah, well, that's great. I learned something. I didn't know you guys did the search and assist. So that's a really great service to the community for sure. I think there was one like last summer, right on the Rio Grande. I remember reading about that, and so that's a really great service. So Julie, do you want to start the question and answer period? Do you want to facilitate that?
Sure. So if anybody has any questions, if you'd like to go ahead and raise your hand, I will go ahead and unmute you and you can go ahead and ask your question. There is a Q&A, so you can enter your question type it into the question and answer area, and when I see those, I can read those. But if anybody has any questions, go ahead and use the raise hand feature. If you are on your phone, I believe it is a *9 will go ahead and allow you to ask a question. And so it looks like Mr. Walsh has a question. Are you able
Yes,
to? Great.
can you hear me?
Mhm.
Hi, I live in Western area, and my question is, what percent of the activity from LAMC is actually related to LAMC patients and not other folks needing help in the 90-mile radius that JP described?
That is a good question. I don't know the exact number, but I would say it's,
Can you give me a percentage?
I don't know the exact percentage. I would say it's maybe 25%.
And how many flights are originating out of LAMC on average per week?
Right. That's what it would be.
25%. I'm looking for a number of flights that originate.
I don't know the exact number, to be honest with you, but I would guess that it's around that percentage.
Does your company have a financial relationship with LAMC?
We do not.
And do you pay rent um, for the use of the pad to LAMC, or does LAMC's parent company have any kind of ownership share in your company?
There is no ownership share, and I don't believe we pay anything to them for the use of that pad. No, there's
In my
nothing that I'm aware of that would be any kind of financial relationship between us and them.
in my neighborhood, there's been quite a bit of noise, and it's particularly bad in the summer when people have their windows open. And in the past, I've tried to talk with the people at the county. There was discussion at the county level with the prior airport manager, Gary, about establishing housing near the airport. Can you talk to me a little bit about the status of that?
Yeah, I can talk to about that, Bob. So this kind of the interim solution that was got started before my time here was that Classic Air or Intermountain Health may end up building a hangar with living space or some type of townhouse with living space on the airport property. When we I don't know if you guys are familiar, but there's a set of old hangars on the west end of the hangar. These guys right here, you can see in my picture behind me.
Okay.
Well, they're gonna take those out that's right here, and then we're going to replace them with we have to modify the runway, I mean the taxiway a little bit, and then there's going to be space to build new hangars, and Intermountain Health is interested in building a hangar there for housing, and so that would reduce the amount of trips up to LAMC and cut down on the noise. And the status of that is that we're working on this summer on a project to build the 8T hangars that would replace the tenants and the hangars that need to get demoed. Once those hangars are built and the tenants can be moved out of the hangars we need to demo, then we can demo the old hangars, and we can rework that space. And so my guess is it would probably be at least 2 years before the land was prepared for the building of a hangar space that would house pilots and nurses from the Classic Air. So that's the intention. And that's a rough timeline. I would say 2 or 3 years before that would happen. And we have been in discussions about maybe a temporary housing solution in the parking lot here, a temporary mobile home or something of that sort that could house people. And we're still in discussions. And Bob Cook might have something to add to that discussion.
I have some other points I want to bring up just as a resident who's very heavily impacted by the noise. It's my understanding is the operation is 24/7.
Yes.
Looking back at the permit on July 8th, 2015, it was for just one helicopter and one company. has there been a modification of the permit to allow multiple companies and now 2 helicopters?
Well, I mean, Bob Cook can probably answer some of that, but I like I mentioned earlier, about 1 to 2% of the flights are from the other companies. So most of the operations are from Classic Air. So that's kind of so I don't know about the contract, but that's kind of the volume that we're talking about. Classic Air operates 2 helicopters, not necessarily at the same time, but Bob can speak to that.
Yeah, I think
just-
also Anne wanted to chime in.
Ah,
Go ahead, Ann.
Thank you, Julie. And I'll turn over to you, Bob. I just wanted to clarify 2 quick things. One is that, that conversation about building a hangar out at the airport really is at preliminary phases, and that, there is no formal agreement, and anything that happens would need to be a formal agreement that ultimately will be a council decision in the future. But we're just contemplating the notion if that could even work at this point with the airport master plan and what that might look like in terms of a release.
Thank you
And
very much. And I'll try and be brief. And I know that there are other people that
well,
may
and
want to
just
speak. Go ahead.
I just have one more clarification. And then in terms of, I think you're talking about, Bob, the heliport land use permit out of the at the hospital
am.
we were talking about. So that's
Yes.
not about, I was here, I was the community development director when that went to the Planning and Zoning Commission and was evaluated. And that's really about creating a safe zone for helicopters to land. That's very typical for a hospital to want that. Prior to having that striping in that area designated, helicopters can land for emergency purposes anyway. So that was just a mechanism for making all the zoning and areas noted properly. But that isn't limited, to my knowledge, to it's really for the safe landing and takeoff of helicopters in that designated area. And that's what it is. It's a land use right that designates that area for it.
My understanding was that it was for a heliport, and with respect. At that meeting, and perhaps you were at it, the representative said that typically there would be 15 calls per month. I, at one point, given the intensity of the situation, was directed by the county to file a complaint with the FAA, which indicated that in a 1-week period, there were 40 flights rather than, I think what Mr. Rogers said, would be 30 or 20 to 25 flights per month would be exceptional. And here we're in a situation, at least in April of 24, where there were 40 flights. I'm wondering if somebody can respond to that in terms of the permitting versus the actuality of what's happening.
I can certainly say that the volume and the permitting has nothing to do, are not related. In terms of the what the FAA is reporting to you and what's actually happening, I defer to the helicopter pilots or companies.
All right, I guess I'll just yield the floor. Just as a citizen in the area and knowing the county ordinances around noise and peace that the citizens are entitled to. And the CEO of Classic Air had indicated that when the expansion happened, that well over 90% of the flights were for people in adjoining communities. And I certainly want everyone to receive services. My point here is I pay taxes for the airport. There are ordinances that establish noise and peace for the citizens in the area. And that just is not happening with the current situation. Gary, I very much appreciate you calling this meeting. My concerns have been for a couple of years, and being told that it's a couple more years does nothing for me, especially when you consider that there are now approximately 150 new apartments within 500 feet of the heliport that are going to be occupied. So I would urge the county to consider some measures that protect the citizens of town from not only the noise, but from the pollution, because these machines use leaded gasoline. I have a friend who lives in the apartments by LAMC, and when there are takeoffs, she has told me that they are washed with exhaust. So with that, I yield. Thank you very much for listening. Thank you all for the meeting. I'll listen to the rest of it.
Okay. Thank you, Mr. Walsh. We do have some questions from Lawrence Tickner, and we also have a hand raised from Jennifer. So I'll go ahead and read Lawrence Tickner's questions. He has 3. How many helicopters does each company have flying out of the LAMC helipad? If 25% of flights are LAMC related, why is LAMC the place for the helicopters to fly out of? Why aren't there other places used? And the last question, there is noticeable noise, notable at night, especially during the summer when we are trying to sleep. The disturbance at night for only 25% of the flights serving LAMC is a problem for us. We are on Pueblo Canyon. So can somebody respond? Mr. Cook or Mr. Martinez?
I mean, I can respond. We don't operate out of Los Alamos at all. We do respond 1 to 2, 3 times a month, specifically for an LAMC type patient. I would say in general that we are 24/7, just like Classic, and we don't schedule the transports. These are 911 requested transports from different facilities, including LAMC. So I wish we could determine what time of the day that we could respond and operate in communities, but I think it's determined on the patients and their conditions and where they're coming out of, and that's just in generality.
Yeah, I would echo that sentiment. If we could pick what time of day we could respond, by all means, I think most of us would pick the day hours. But yeah, I just wanted to correct, was it Bob? I believe he said we use a lead-based fuel. That is actually incorrect. We use Jet A, which is a kerosene type fuel. As far as the noise, like, I recognize that it is a lot of volume, and we do use some flight paths and elevations with our flight paths to try to make that as palatable as possible, to try to be neighborly and try to keep that as minimal as we possibly can. Unfortunately, it is still the place where we fly into and out of. The main reason is mostly due to that's where we originated. That's kind of where we started from. And at the time when they applied for that heliport status, that probably was indicative of our volume. That 15 and 20 to 25 would have been a busy month at that point in time. That was back in 2015. So, things have steadily gotten busier and busier every year, to the point where we added the second aircraft. The housing situation was kind of acquired to accommodate responding from that helipad location. And so, while we're open to alternatives, the options of, changing that to a point where we respond from the airport, there's a lot of logistical considerations that go into making that actually happen. And unfortunately, it's just not a fast process. So, there's a lot of planning that has to go into it and a lot of financial considerations that go into it. And we're certainly open to exploring that. We just haven't gotten very far down that road yet.
Okay, we also have a question from Jennifer. Jennifer, if you want to go ahead and unmute yourself and ask your question.
Hi, I was woken up this morning at 4:15 from a life flight. So I was a little bit late coming into this, but I have several concerns about what's going on there. I thought all of them were life-threatening flights that were flying in and out of there. So for several years, being woken up 4 and 5 times a night, I'm on the edge of a canyon where they fly right over my house, and it amplifies and reverberates, and it's really loud and really low and slow. And so I thought, well, Jennifer, just kind of suck it up. And so I called the FAA and I talked to a Dave there, and he was 30 years a pilot for LifeFlight. And I asked him, I said, Dave, what a percentage of them are really life-threatening flights? And I said, I heard from a couple doctors who lived in the East Coast that maybe only a few percentage of them are life-threatening flights. And nobody would care if it was someone that was in dire need that, you know, would fly over at 3 a.m. and wake everybody up along their flight path. But it's only a few percentage. So out of 90 flights, or how many ever someone texted me that we are having a month, maybe 87 of them are just transporting. It's like a bus station there. People just go there to take, you know, drop someone off, and then they fly them off to someplace else. We used to fly into the air. I am a pilot. They used to fly into the airport and then take an ambulance 2 miles to the hospital, and therefore it was trains, planes, and automobiles. You know what I mean? Instead of waking up people all night long, all day, constant noise. And I don't know, it seems to me that, you know, in a congested area, you have to fly 1,000 feet above the area so that it doesn't, in case it crashes, for safety for the pilots and the people, and for the noise pollution. It just, I don't understand why this is. And I was told that there is a contract that the hospital is being paid to have the flights landing there. So I would like to know what the real story is, and if we could compromise and fly into the airport where things that are supposed to be in the air land all the time instead of flying over everyone's houses. I mean, we are being impacted an amazing amount of time. And I am an older person now, and when I wake up at 11:30, 3:30, 4:15, I can't fall back asleep again. And that is a health issue for people on the ground. So I'm all about people in distress, getting help and all that other kind of stuff, but not at the cost of the insurance company making $60,000, $80,000, $120,000. I have no idea, but it's an extreme amount of money that you guys are getting for these flights. And I don't think that that's right. I don't. And if somebody is in, you know, I have a friend who actually was flown out. They had to actually even fly her all the way to San Diego. But we don't have anyone here to deal with life-threatening stuff. We used to be the premier hospital in northern New Mexico. That is not the case anymore. So, you know, if somebody needs to fly in right to the hospital and be taken care of, 1 or 2, 3 flights a month, that's totally fine. But not 90 a day. I mean, several. I would love for someone to be here in the middle of the night and wake up and hear that. And when they land at the airport, I swear to God, it's probably a half hour as a bird, or half of a mile as the bird flies. And the helicopter rotor winds down. So it's several minutes on the ground making this terrible loud noise. It's unbelievable. And if it's in the summertime when the windows are open, you know, if it's not barking dogs, skunks, or I tell my grandkids that they are flying lawnmowers. That is how loud they are. If I decided I want to do a lawn mowing thing at midnight and do it, you know, to make money, people would be all over me and say, no way, no way. But if it's a helicopter and it's a life flight that isn't really a life flight because they need to get a stent down in Albuquerque, it would never fly. Do you know what I'm saying? So this has been a long time coming, and I don't know. I just really need to know what the real story is and what you guys are going to do to compromise for all the people that are being affected by it. And I know a lot of people who were in the war, and they have PTSD from listening to all these helicopter flights going over. The world is literally and figuratively heating up. And something needs to change about this. And bless you guys for doing your job. I do my job, but I don't do it at the cost of other people. Thank you
Did
for
you have a
listening to me.
question?
Huh?
Okay. Oh, I was just asking if you had a specific question, or did you just want to?
Well, no, I had a question. What's the percentage of it and what are you guys going to do about it? Because all of these things, there's airways you have to fly, and they fly over my house, and instead of like alongside the canyon, I know next to the twist domes or whatever along that side there. I mean, it's willy-nilly. And I've called Classic Air and told them, and they're like, well, we have this changeover of pilots, blah, 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 blah. And so it's like, take a picture of a helicopter flying over your house. And by the time you get there, you're on your little phone. But okay, so what, can't we fly into the airport? Can't we compromise? Fly into the airport and take an ambulance for 2 miles. And if somebody has a life-threatening thing, fly into the airport. But there's only a small percentage a month that happens. It's not every day, all day long and all night long. Where's the compromise?
So to answer the question of the frequency of life-threatening, I would say I apologize to you for whoever misled you to think it's a very small percentage, because I assure you it's actually quite a bit more than that. A lot of those conditions, if they're not life-threatening right now, they will become life-threatening if we don't transfer them urgently. And so that's, I feel bad for whoever told you that, because I don't know. Well, I don't know what their situation is, and maybe that is true for them, but it is certainly not true for us. As far as, like taking an ambulance and responding from the airport and things like that, the only thing, I could see where maybe that would help for your neighborhood, but I think that would make it worse for the neighborhoods that live closer to the airport. Not to say that, that it's not more beneficial for more people, it might be. And, if there is some things that we can do to work towards responding more from the airport, we are certainly open to looking into those options. We just, like I said earlier, we just haven't gotten very far down that road yet. And it's not like it's not something we can accomplish quickly. So I do apologize that it's noisy for you and disturbing. Like we do live along our flight paths as well. Our med crew and not the med crew, but our pilots, actually the housing for our two houses that we house our pilots in, do live right along our routes of flight as well. So they are affected as much as anybody else along that path.
Okay, so we also have a question from Barbara. Barbara, do you want to unmute yourself? Barbara, are you able to unmute yourself? Well, we can come back to Barbara. I will go ahead and move on to Robert. Robert, do you want to unmute?
Can you hear me?
Oh, great. Yes.
Hi, I don't have any questions. I'm actually the lead pilot here for Classic Air Medical in Los Alamos. And I just wanted to jump on and address a couple of the things from the last 2 speakers, and just kind of give a little bit of a pilot's perspective from what we do here. So first off, I think Bob kind of addressed it a lot, but the life or death thing, that's just not accurate for what we do. And that's actually not our thing anyway. The requests come from a 911 call or a medical facility. They're the ones that are determining if a patient needs transported. That's not our call. The other thing that I wanted to address is, I believe the last speaker was saying that there is 1,000-foot floor. That is not accurate for helicopters. That's an airplane regulation. For helicopters, they ask us to stay at 500 feet over populated areas, except for the purpose of landing. So if we're coming into the hospital, we do try to stay as high as we safely can until we have to descend to land at the hospital. As far as noise on the ground, our helicopter does have a 2-minute cool down that we have to do. That is a limitation of the helicopter. I wish we could shut it off as soon as we land and kill that noise, but that is a requirement of our helicopter. So we do have to run that for 2 minutes to cool off. And the other thing was the passive flight. That one kind of bothers me because I actually do our pilot training here, and I do very much stress our passive flight that we have. We fly through Lano as much as possible through the canyon there. We have set altitudes. If we have to come over town, we try to stay over the canyon, over the basically over where the high school is, and try to keep the noise down as much as possible. We do try to fly as neighborly as possible. And I'm always open to adjusting those routes and to working with anybody that has any suggestions to make that better. But we do very much try that. And there is mistakes, and we do have new pilots coming in where there's training going on or there's somebody filling in and stuff, and mistakes happen. We are human. But we do very much try to stick to those routes and keep as neighborly as we can. So that's all I wanted to address. And if there's anybody that has any questions on that, I'm happy to jump back on and answer those toward the end of the meeting.
Thank you, Mr. Adams. Barbara, do you want to try again? Barbara, are you able to unmute yourself? Okay, we'll go ahead and move to we have some more written Q&As. Cheryl K says that she lives near the high school and the noise, especially between midnight and 6 a.m., is a major problem for residents in her neighborhood. If flights are not related to emergency activities at LAMC, consideration should be given to alternate locations at the airport. I don't know if anybody wants to respond to that. She also has another question. Flying over the canyons results in a great deal of reverberation from the helicopters. The situation is not very neighborly. We also have another question from Mr. Tickner. Does the county have any responsibility to its citizens to work out a situation that doesn't require non-life-threatening flights at night? I don't know if anyone is able to answer that, Gary or Eric.
I don't know that we have any way of knowing that that a particular situation is not life-threatening until we actually get there, to be honest with you, because the way our dispatches come in, they have an illness. They don't necessarily grade a severity to it. So we might have an idea of what we're responding to, but we can't, without being there and doing the assessment and looking over, the radiology reports and the labs and things like that, we couldn't tell you that it's not life-threatening based on the dispatch that we get.
Thank you, Bob.
Julie, if you don't mind,
Sure, absolutely.
I know we don't operate 24/7 out of Los Alamos, but I think I want to echo what Bob and the lead pilot mentioned is like, I think it's important for the community to know that probably all the companies that operate in Los Alamos operate with processes, procedures, manuals that are approved by the FAA, and then clinical procedures and follow-up processes that assure that the utilization of that team for that transport are reviewed 100% of the time, and we're providing feedback to our customers probably 100% of the time. The flight paths and the procedures operating that aircraft are heavily regulated with our manuals, and then again in communication with the FAA. So these are things that we're not doing individually that say, hey, we're going to purposely fly over a certain area. And there's a lot of things, a lot of training that goes behind operating that aircraft at 2 a.m, and they're being reviewed and providing pilots and the crews training on how they can do things better the next time. And again, I'm pretty sure I could probably speak for a while because we've handled these situations before in other areas. We are trying to find better ways to be neighborly by following noise abatement paths and altitude. But to what the pilot said, we have to land, we have to operate, and when you're in the vicinity of LAMC, you're going to be 500 feet or below on that approach path, and that's probably what's creating a lot of risk. Again, it's not purposeful, but just the nature of the business.
Thank you. We have a question from Dean. Dean, do you want to unmute yourself?
Yes, ma'am. Thank you. Can you hear me okay?
Yes.
Hi, good evening, and thanks for your time. My name is Dean Roderick. I'm the operations manager for Classic Air Medical, specifically over aviation. And thank you for your time and hosting this meeting. For about 10 years now, Classic has been operating out of Los Alamos, and we are grateful to that community for allowing our aircraft to initially be positioned there and support the community. Over the last 10 years, we have seen volume increase, and it has not specifically come out of Los Alamos or LAMC, but we do have a significant operating area. It's 90 miles was mentioned earlier. You know, we frequently operate 150, 200, 250 miles out of Los Alamos, Denver, Las Cruces, Lubbock, Flagstaff. We have quite a large footprint. We do recognize that our volume has become somewhat of a hindrance and an annoyance within the community, and we are actively trying to find a solution that will allow us to continue to operate in that location, support Los Alamos and surrounding communities directly, and also help relieve some of the noise that that the folks in Los Alamos have. And unfortunately, those processes and procedures and plans do take some time, and they do take money. And we're working with the county, and we would really like to continue operating out of Los Alamos. And ideally, it would be from an airport location because that does make sense. Excuse me. But again, that does take time. And just a comment on some of what I've been listening to is that, we operate a critical care transport team. When we're being called, it is for a reason. We are unbiased in what that request is when it comes our way. Our job is to be ready to respond to that situation, whatever it may be. Is it life-threatening? High likelihood it is. Is it not? I hope not. But again, we are unbiased in that response. So thank you, Los Alamos, for hosting us. And we would like to continue to operate there. And we hear what you're saying, and we're actively trying to find solutions. So thank you.
Thank you, Dean. We have some written questions. Anonymous asks, can the helicopters be located at the airport and fly out of the airport and down the runway, just like the planes, to keep the noise down? Can anybody answer that?
So as it currently stands, we're not set up to respond from there the majority of the time. Essentially right now, it's mostly due to location of housing and the response times that would require. It would be significantly delayed. And like Dean explained, our purpose is for critical care transport. But like he said, we are actively looking and we are open to those solutions, trying to work towards that goal. But as of right now, it would not really be feasible to do that the majority of the time. And I see, Dean, you have your hand back up. Is that to respond to that?
Yes, it is, Bob. Hello?
Yes, we can hear you.
Okay. Yeah, I was just going to paint a little bit of a picture of our operation there. You know, we do have our helicopters primarily based at LAMC because of the logistics of that location. We typically have a response time for when a call comes in. We're looking at about 10 to 15 minutes, depending on the situation, to be off of the ground. Again, it's an emergent situation. We are not exactly sure what we are going to, but our role is to be available 24/7, 365 for that response. So strategically, from the hospital, it makes sense for us to operate there. However, from the airport, which would be an ideal location to operate out of, it's not logistically feasible for our operation at the moment, considering where our housing is and where our crew is housed. And it creates a significant delay in our service. So backing up to some previous comments on trying to seek a solution that would allow us to operate eventually out of the airport or somewhere we can acquire housing that would allow us to do that. So.
We have Barbara submitted her question through the Q&A, and she says, is the helipad at the hospital because of a contract with the hospital? Is this driven by LifePoint more than the helicopter companies? You was told you transfer other patients from other cities, so when we hear the helicopters, they're not necessarily transferring people from here, but taking off to go to another location. Does the hospital have trauma ER capability, or are we transmitting most people? Could we use road ambulances instead?
So, sorry, get my buttons to work here. As far as there is no contract with LifePoint, so that is not being driven by LifePoint. The volume comes from wherever it happens to be called from. So it could be somebody on a street between Los Alamos and, you know, the Jemez or Sandoval County or Espanola. It could be, you know, it could be anywhere that's within our reach. As far, I'm kind of gotten lost on the rest of that. Sorry, that was it being driven by LifePoint? I would say no. I can't.
So she says she was told, I think you answered that part. Does the hospital have trauma ER capability, or are we transferring most people?
Yes.
Could we use road ambulances instead?
So to be honest with you, I don't know what percentage of the traumas that they get, they transfer out, because we only see the ones that they transfer out. They do have ER capability. They do have some trauma capability. To what level, I'm not sure. Our relationship is, you know, is not such that I know how much I see that goes into their facility. It's just what I see that we take out of their facility. So, and then as far as using road ambulances, they actually do use road ambulances from time to time. So that is essentially an appropriateness, I guess, consideration on their part. And they actually do utilize that at times. So it's kind of up to them to determine if it's appropriate to do that. And then if it is appropriate to do that, is that available to them at the time? And that would determine whether they use those road ambulances. And then if it's something more critical that would not be appropriate, then they would call us, or, you know, Air Methods or Lifeguard or whoever else in the region if we're not around, or if it's a specialty that we don't do. And then also if it wasn't available to them, then they would need to figure out a different method, which would usually be one of the flight services.
So it looks like Gary wanted to add on to that, and we also have Chief Pacheco from our fire department on the call as well, if you wanted to add anything. Gary?
Yeah, I just wanted to add to what I think she was also asking the question, whether the helicopter is sitting up at LAMC and then you get a call to transport somebody, say down in Albuquerque somewhere else, is the helicopter leaving the helipad from LAMC without a patient? And are you serving other communities that aren't related to LAMC? And the helicopter is just sitting there. I think that was one of the other questions that she had. Just also to back up with what Dean was saying, if it's a 24/7 operation, they're not sitting in the helicopter waiting for the call. They're in housing. I just want to make sure that everybody understood that. So there has to be housing where near the helicopter so that they can, leave the housing, go to the helicopter, respond to the thing. And that's why they're up at LAMC, because that's both where the helipad and the housing is. So that's all I had.
Yeah, so similar to the fact that we don't know what we're going to be called for at any given time, we also don't know where that next call is going to come out of, but we do respond without prejudice to wherever that is requested from. And I see, Dean, you also had your hand up. Do you want to chime in on that?
Yes. I don't know if I'm still unmuted, Julie.
We got.
No, we can hear you.
Okay. Gary answered what I was going to say. There is that yes, we are sitting at the helicopter pad, and at LAMC, we do not know where the next call is coming out of. So if it is out of the area, say out of Los Alamos, in another region, then yes, we are responding without a patient from that pad.
Chief Pacheco?
Yeah, hi, Julie. I just wanted to comment and just echo what Bob spoke about regarding ambulance transfers. Yes, we do take ambulance interfacility transfers from obviously facility LAMC to other facilities, but we are not a critical care service. We're an advanced level 911 advanced level support service. If it requires anything that is critical care or emergent response, such as a trauma, Albuquerque UNM is the only level 1 trauma center in the area. So if it's a high acuity trauma call, anything that requires anything that's above us, it's much more efficient to get a patient that requires that service via a helicopter.
Thank you. So we have some more questions. Cheryl says it would be optimal if they could operate out of the airport instead of the hospital area. In my opinion, as a citizen, this should be a priority. For time and money, this is not an appropriate excuse. Mr. Tickner says, so the flight companies don't know if it's a life-threatening unless they are told. So the county would need to require that the hospitals asking for helicopters from or to LAMC certify that this transport is life-threatening. Can the county require this? Is anybody able to respond to that?
I can't speak for the county, but I would assume Dean would confirm this, but the physicians do fill out a form saying this is medically necessary. This critical care team does require time-sensitive transport or critical care transport.
Okay.
Yeah, that is correct. We don't transfer anybody without a form that essentially is filled out by the sending team that does certify what the medical necessity is for that transport. So I don't think it would even be feasible for the county to know when there's a request being made, honestly, to be able to require that.
Okay, thank you. Lauren Stickner also asks, the county should be willing to find out what percentage of flights in and out of LAMC are life-threatening and what time of day these life-threatening flights happen. Is the county willing to do this? I don't know if this is something that we can do, Anne.
You know, what I would say is, I think we can request information from the helicopters. We have no jurisdiction to require it, that I'm aware of, but I do appreciate the helicopter companies, you know, being willing to be here even tonight to have this conversation at our request. And I'm sure if we were to have, try to request additional information, that might help communicate it, I'm sure they'll be agreeable, to the extent that it's information they are able and willing to share with us.
Thank you.
I would say it's a fairly high percentage. Like I was explaining earlier, if it's not life-threatening right now, it's going to be life-threatening soon if they don't get to the place they need to get to. So I would expect that the majority of those would come back in the affirmative.
Thank you, Bob. We're getting close to 6:30 and we have 2 more questions. So I'll go ahead. Oh, 3 questions. We can finish up with these 3. Jennifer Leone asks, I live in the western area and the noise pollution from the helicopters coming and going from LAMC is exhausting. The volume of flights has increased dramatically since the special use permit was issued in 2015. In the discussion by the P&Z board when the permit was granted, lack of resident complaints was cited as a reason to go ahead with the permit. This was when the volume of flights was 15 per month, a very different situation. The county needs to act to move to the airport. And I'll go ahead and move to Christopher McLean, if you want to unmute yourself.
Thanks. Yep, I'm Chris McLean. When the helicopters started flying, they were based at the airport. Is that correct? For a short amount of time.
Back in 2015, honestly, I wasn't there yet, but it is my understanding that their initial responses were from there.
And so there has been history that they were based at the airport, and you've been arguing this time that because of housing that you have to be based at LAMC, which is not correct, because when you were here, you were based at the airport already and you got housing based on that. I know some of the folks were, housing around Los Alamos. We all know that the housing here in Los Alamos, it doesn't take very long. I did a quick mapping to see how long it was from the airport to LAMC. It's 8 minutes, according to Google Maps, right? You said your response time is 10 to 15, right? So even with your housing and the response time and the additional response out to the airport, you're still within your 10 to 15 minute window. So your arguments of not being able to be based at the airport because of housing don't really hold a lot of water. With all of us complaining that the increase in noise pollution, I think outweighs the small amount of, time that you would have to devote to being based at the airport. You have a hangar there, you have space for, supplies. I'm guessing your gas is still at the airport, so you get gas out there. So I think I hear your arguments, but I don't think they hold that much water of why you can't move that back out to the airport like when you started originally here. So that's really my take on it. So I would ask that the county really look at that and say, hey, they started at the airport. This was how we started with them. Their argument for not being able to move to the airport because of proximity to housing doesn't really hold water. We know Los Alamos is small, housing is close, and so I think I will leave it with that. Thank you.
Thank you. Can I respond to that?
Please.
That is not entirely accurate. We do not have our medical crew members and our pilots in the same location, unfortunately. Our medical crew, which we have 4 to 6 medical crew members at any given point, are housed closer to the golf course. So driving from that location all the way to the airport,
Mr. McLean?
So sorry, I had muted myself. Yeah, I mean, so maybe he's close to the 15-minute window. It's not that far. Like I said, it's 8 minutes from the Los Alamos Medical Center to the airport. So I still think, the argument that, it's extra, it's going to increase the response time. Yeah, okay, so there's 8 minutes increased response time. The amount of flights they have now and all the people who are, saying, hey, the noise is really impacting us. If they want to continue to operate here, right, I think they need to take that in consideration. I think the county needs to take that in consideration. And really, I don't think that 8 extra minutes of response time weighs that high with all the residents that are being impacted.
I apologize.
I can certainly
Go ahead.
I can certainly understand your sentiment. That 8 minutes is a lifetime for somebody else, though. But that's a discussion we can get into at another time. I don't know if this is the forum. However, I did say earlier, we do recognize that our volume has increased substantially, and we would like to be good stewards of the community. And the time has come where we are seeking solutions so we can operate in a more desirable location for the community. It takes a little time to do that. I'm hoping that we can work with the county. I'm sure we can. We have a great relationship with them. And moving forward, I look forward to see what we can do over there.
Okay, so we'll go ahead and take just this last question from Mr. Walsh. And then I think we'll have to wrap up.
Thank you for having the meeting. At times I felt like I was the only person fighting the windmill. So after having listened to this, what I'm hearing is that the reason that most of the flights have to originate at LAMC is housing. I would remind the county administrator that this area, LAMC, is the most densely populated area in town. The maximum number of people are exposed to this noise. It's impossible to find more people living close to this place anywhere in the county. So I feel the whole discussion is a little disingenuous. The county administrator seemed to imply that it could be 2 or 3 years. I agree with one of the prior speakers in that this is happening now. This has been happening for a couple or 5 years, and we need relief now. If that means Classic Air buying a double-wide trailer or 2 double-wide trailers and putting them in the empty parking lot at LAMC so that their crew can be in proximity to the aircraft at the airport, that's a simple solution. In the meantime, I'm asking that the county review the initial permit, the details and the conditions that were present when it was issued. I also, considering the ordinances, the noise ordinance, I'm requesting specifically a permanent monitor of noise in the vicinity. It could be at some of the apartments across the street or the new apartments, because you haven't heard from those people yet. You're going to hear from those people big time. And I think that's probably within 1 year, but that there be some kind of permanent monitoring of the noise in addition to the people who live. I'm talking about hundreds of households here who pay their taxes. I don't know how much Classic Air pays in taxes, but the county represents the residents, not the helicopter company. I'd like the county to request that the helicopter company post the frequency and the time of the helicopter flights. So we have some data. We have data about noise and we have data about frequency. I asked very specific questions at the beginning, and I did not get specific answers about the percent of flights that actually were taking LAMC patients. Most of the people in town, when you bring this up, believe that 100% of the flights are LAMC patients. That is not true, and the residents don't realize this, and they're tolerating it really to the benefit of the profit of this helicopter company. So I thank the participants. I'm sorry, and I expect the county to respond to this. This is affecting thousands of people at a high frequency. Noise pollution is a health hazard. Thank you for your time.
Thank you, Mr. Walsh. So we've spent our hour. I don't know if anybody wants to wrap up. Gary, if you want to say anything to
Yeah. I'd be happy to wrap up a little bit. I think we heard a lot about how the noise is impacting. I think, we have a lot of constraints here, but I think that there are things that we can probably look at and work with. And, some of the suggestions of housing near to the airport and things like that, we can look at that and talk about that. I think that, we certainly have a lot of flexibility out at the airport, and whatever we can do, I think, as the county to help. We'll have to look at that. Like I said, there's a lot of constraints. There's a lot of operations, logistics that need to be considered, as Bob mentioned, Cook mentioned before. So, but I think, we heard what an impact it is, at least. So I think it probably behooves us to look a little deeper into this. So that's my opinion on that. But I appreciate everybody coming out and voicing their concerns. We have a lot more data to work with. Bob, do you want to say anything to close out?
Yeah, first of all, I want to thank everybody for jumping on, expressing their concerns. I think we have heard of a couple folks, and so it's definitely nice to get on here and see that there's more than just a couple, and to hear some of the things that they have to say. So I do appreciate that. We also have some locals that work for us. So like some of our community is your community, and we're very proud to serve this community. So we're very proud to be in Los Alamos. It's a beautiful place. We don't want to make that not a beautiful place for you either. So yeah, we're absolutely, we will look into doing whatever it is we need to do to try to make this some sort of like either compromise or a more long-term solution. Whatever it is we can do to get to that point, we are certainly willing to look that direction. So thank you all for expressing what you have to say and for being here with us this evening.
Yeah, thanks a lot, Bob, and thanks, JP, too. I appreciate you showing up.
And I was just going to say that this meeting has been recorded, and we will post it on the airport webpage so that you can view it at a later date. So, so with that, thank you, everybody.
Thanks, Julie.
Yeah.
Thanks for having me. Appreciate it.
Thank you.